Hi, Miss Nikki here. Today we are going to cover part one. I'm going to go through the ovarian cycle. And then in part two, we'll go through the uterine cycle and talk about other female reproductive structures. So hopefully we're okay with this terminology. What's the primary reproductive organ for the female? It's the ovaries, just like in the male, it was the testis or testes. We're going to look at some accessory reproductive organs, the uterine tube, uterus, vagina, external genitalia, mammary glands. Again, just like when we looked in the male, ductus deferens, this is kind of homologous tissue to the prostate. External genitalia, we'll talk about labia majora and minora, and that's homologous to the male scrotum. So we're going to see a lot of kind of comparisons through this PowerPoint. Here's the female reproductive sagittal view. You can see here the urethra, and you can see the bladder. You can see the vagina here. Here's the cervix. We've talked about this several times. And then here's the uterus. Then you can see the anus here, anal canal, rectum. It's hard to see from this view. I have another one coming up, but the uterine tube comes out of the uterus, and then we're going to see some of these accessory structures in the next PowerPoint. And this right here is the ovary. So ovarian follicles are the site of oocyte production and the release of sex hormones. So the ovarian follicle, very similar to the testes and the seminiferous tubules. We're going to see paired ovaries. They're in the pelvic cavity. This usually throws people. They're slightly larger than an almond, right? That's pretty tiny, right? We think they're much bigger than that usually. Here's a nice image showing you kind of the span of all of the connective tissue, the ligaments. So just something to point out, here's the ovary. It is attached by the ovarian ligament to the uterus. We can see the uterine tube here a little bit better as it comes from either going to the uterus or from the uterus. We can see the uterine tube kind of makes this curl, and then it widens, and then we have these little finger-like projections. You can also see here this broad ligament. So all of this tissue that's helping keep all of these reproductive organs together, or kind of in the location of the pelvic cavity. Remember, we have small intestines on top of this. We have bladder. We have a lot of things that are moving. So we have this nice broad ligament. We have uterine arteries and veins. We have ovarian arteries and veins. And also something to notice, these fimbriae, they're just barely touching, and they're not always touching. So when we talk about the release of an egg or an oocyte, it has to be swept up by these fingers, these fimbriae, into the infundibulum, which is this section, or the ampulla of the uterine tube, which is where we have the site of fertilization. You can see the cervix here and see how part of the cervix actually drops into the vaginal canal. So it creates these kind of little pockets over here that we'll talk about later. Just a little more information on the ovarian arteries and veins. They are direct branches off of the aorta. Before, we were just calling them gonadal, right? So we had our abdominal aorta, and we had these paired, it was the artery and vein, and we kept saying gonadal arteries and veins. Just if it's going to the ovary, it's ovarian artery. If it's going to the testes, it's testicular artery. Here's a cross-section of the ovary, and we're going to look at the development of these primordial follicles as they move to primary follicles, secondary follicles, and then finally this mature follicle. And you'll see that this pattern kind of looks the same, right? From when we did spermatogenesis, we had the spermatogonia, they turned into primary spermatocytes, secondary spermatocytes, and then eventually we had 4 spermatids, right? We're going to see the primordial follicles turn into primary follicles, secondary follicles, and then we're going to see fluid build up here. And then eventually a mature follicle where the oocyte has kind of moved to one side. There's a lot more fluid buildup here. And we're going to see that the oocyte is ovulated or ejected from the ovary. So again, remember, females only make one gamete instead of the 4 per set or round of meiosis 1 and 2. So we're going to go through this step by step and talk about what happens at the end, and we're going to kind of correlate some of this to pregnancy as well as we move through the slides. So the ovarian follicles, we're going to see an oocyte surrounded by follicle cells, and we're going to go through these different developmental stages. So first we're talking about these primordial follicles, and if you look, there's a ring of cells around. Here we're talking about primary, but I think it's a little easier to see that there's a ring of cells around the actual oocyte. And then as the cells start copying themselves, then we still see the inner part, right? That's the actual oocyte. All these cells around them are follicular cells, also granulocytes. So starting with primordial follicles, think of these as like germ cells, right? These are the ones that you were born with as a female. They have started meiosis 1, prophase 1, and they've stopped. They are arrested. You have 1.5 million at birth, so the idea that as a female you have all the eggs you're ever going to have at birth, that is true. You're not going to make any more primordial follicles. A primary follicle forms from a primordial follicle. The primary oocyte with a single layer of these follicular cells is now called a granulosa cell. Primary follicle secretes estrogen, and this estrogen is what's going to talk to the uterine lining and tell it to start growing, basically. But we'll get to this. This is called the uterine cycle. So we'll talk about that in part 2. Immediately surrounding the primary oocyte is this zona pellucida. It has a lot of glycoproteins. It's like a protective coating for the oocyte. So here's a primordial follicle, and some of the terminology there, we would say this is an oocyte surrounded by follicular cells. When this primordial follicle starts growing into a primary oocyte, so this is first, this is second, the primary oocyte, we're going to start seeing the development of the zona pellucida, and we're going to see that these cells, these follicular cells, start dividing, and so now they're called granulosa cells. So if you see primordial follicle, follicular cells, oops, and if you see primary oocyte, they call them granulosa cells. Secondary follicle forms from the primary. Primary oocyte has many layers of granulosal cells. There's also some thecal cells that are on the periphery, the outside. That should be kind of ringing a bell when we talked about interstitial cells, right? These are cells on the periphery of the follicle. They secrete androgens, but in females, they're converted to estrogen. So this is a nice image of a secondary follicle. You can see there is an increased number in granulosa cells. You can also see the zona pellucida has increased in thickness. You can still see the oocyte here. With the purple, they're trying to show you the cell membrane. And surrounding the granulosa cells are the thecal cells. And the thecal cells are going to secrete androgens, and then the granulosa cells here are going to turn those androgens, get it out, into estrogen. So this antral follicle is kind of like a midway point. So we're here, we just saw a secondary follicle, and we have to get to mature follicle. So this antral follicle is kind of like this midway point. So the antrum, the space, is going to start filling with serous fluid, and it comes from these granulosal cells. The oocyte gets pushed to one side, and you're going to see the zona pellucida and something called the corona radiata. So it's going to be external to the zona pellucida, and it's going to have this accumulation of cells. Here's a nice picture of an antral follicle. We can see that we still have thecal cells here, right? So those thecal cells are going to be triggered to release androgens, and that's going to cause the granulosal cells to change it to estrogen. That keeps this division going, right? Keeping the estrogen high enough causes this follicle to keep developing. We can see that fluid starts filling in around the oocyte. So oocytes here. And we have our cell membrane. Then we have our thick zona pellucida. And then some of these granulosal cells stay around the zona pellucida. Finally, we get to a mature follicle. So this mature follicle, you can see that the oocyte has been pushed all the way to one side of the follicle. We have tons of fluid buildup here from the granulosa cells. This is going to cause the completion of meiosis 1. So remember, up until now, we were frozen in meiosis 1, prophase 1. So once we get to this mature follicle, we're going to see the completion of meiosis 1, and it's going to stop in the middle of meiosis 2, metaphase. It's going to wait. And one of these mature follicles will be formed per month. The corpus luteum is what remains from the follicle after the oocyte is ejected and expelled. This corpus luteum is going to secrete sex hormones, progesterone the most, and estrogen some. It's going to help coordinate the buildup of the uterine lining and prepare the uterus for possible implantation of the fertilized zygote, or fertilized oocyte, which we often call zygote. Eventually, the corpus luteum is going to break down, and we'll have the remnants, which is the corpus albicans. It is scar tissue. It will be reabsorbed, but during the process, you can still see the remnants as it's breaking down. So let's walk through this again. We have the primordial follicles here. The primordial follicles are going to develop into primary follicles, then into a secondary follicle, then an antral follicle, then a mature follicle, and then during ovulation, this oocyte with the zona pellucida and the cells around it, corona radiata, are ejected, if you will, ruptured, ovulated from the ovary. So then these remaining granulosa cells turn into something called the corpus luteum, and the corpus luteum's job is to secrete progesterone and estrogen. And then eventually, when the corpus luteum has done its job, it's going to start breaking down and turn into the corpus albicans. So this term oogenesis, we're trying to create those secondary oocytes, right? Eventually have ejection of this oocyte from the mature follicle. So before birth, the ovary has these primordial germ cells, oogonia. They're diploid, they're going to divide by mitosis, and they're going to produce primary oocytes. So just like we had spermatogonia and spermatogonia produce primary spermatocytes, same thing. Oogonia is going to undergo mitosis and create these primary oocytes. They're going to start meiosis, but they're going to be arrested in prophase 1. So this is something that's different in females. They're now called primary oocytes. So we start with 1.5 million follicles within the ovary. So here's your primordial follicle, and inside of it, it has your primary oocyte. And these are going to remain arrested in prophase 1 until puberty. In childhood, your ovaries are inactive. There is no follicular development, so we just have those primary oocytes. And some of those follicles are going to be broken down by just naturally, right? By puberty, we're only going to have about 400,000 follicles remaining in the ovaries. The follicular phase is the first 2 weeks, we'll say, of a 28-day ovarian cycle. So some people's cycles a little bit more, a little bit less, and we'll talk about how the hormones from the ovary dictate what happens in the uterus lining. But let's just say the first 2 weeks, you're going to see primordial follicles stimulated into mature primary follicles by LH and FSH. We do not want to know why some are stimulated and some are not. The granulosal cells can also release inhibin. We've seen this term before. And this goes back and shuts off FSH production. So it acts as negative feedback. So a few primary follicles are going to mature into a secondary follicle. Only one matures to, they call it a vesicular follicle. We also call this mature follicle. Primary oocyte finishes meiosis 1 and forms 2 cells. One's going to be the polar body, and the other is going to be the secondary oocyte. So it becomes secondary oocyte. So what they're saying is we have a primary oocyte. It's going to divide. It's going to do meiosis 1. It's going to finish meiosis 1. And you'll have one polar body and one secondary oocyte. So let's just do the males really quick. We had our male primary. It divided into 2, right? And then those divided into 2. I'm purposely not putting the chromosome number here from what we talked about last time. Remember, it's a total of 46, but it's still considered haploid because it only has a copy of either mom or dad's chromosome. So there's technically still 23 chromosomes there. There's just a copy, right? Okay, so with males, we took a primary spermatocyte, turned it into secondary spermatocytes, and then we ended up with 4 spermatids. Here in female, this was meiosis 1, right? This was meiosis 2. In the female, we have our primary oocyte, and our primary oocyte is going to divide. Now we should be at secondary, right? This is the polar body, and this is the secondary follicle. So the reason that we do this is this polar body donates cytoplasm, and then it sequesters or makes sure that the chromosomes don't mix, basically. So you're dividing, finishing meiosis 1, you're taking the chromosomes and putting them in this cell, but this polar body is donating its cytoplasm so that this secondary oocyte can be larger. So during ovulation, we would have already seen the secondary oocyte turn into a mature follicle. Ovulation is when we have that mature follicle and we have the oocyte kind of pushed over to the side. We're going to see that LH has to come from the anterior pituitary and trigger the ovary to push out this oocyte. The antrum is going to increase, it's going to swell, and it's going to expand until the ovarian surface thins, kind of like you're pushing on the inside of a balloon. It kind of stretches out the outer coating of the ovary. It's going to rupture, and it's going to expel the secondary oocyte. So it's a combination of things. It is the fluid, right? So the fluid is going to increase and swell, and then it's also the LH signal. So you have to have enough fluid in here to create enough pressure to push out the oocyte, but you also have to have the signal for that to happen via the LH. The luteal phase is the third phase, or the ending phase, the last 15 to 28 days of the cycle, where those remaining granulosal cells from the mature follicle are going to secrete estrogen and progesterone. They build up the uterine lining to prepare the fertilized oocyte. Lasts about 10 to 13 days. If the oocyte is not fertilized, then it's going to turn into the corpus albicans. So if there is no fertilization, right? So no fertilization, then the corpus luteum is going to regress, start breaking down. You're going to see a drop in estrogen and progesterone, and that's going to trigger menstruation. You're going to see the endometrial lining is going to shed, and this marks the end of luteal phase. And what's going to happen? You're going to start the process all over again. So the first menstrual cycle around age 11 to 12, we've seen previously 8 to 12 being kind of the new norm. So menarche is the first menstrual cycle. I like this comparison because it's showing you what's happening with mitosis and meiosis, and then it's showing you what's happening in the ovary. So here is our oogonium. This would have undergone mitosis. This is all pre-birth. That's going to turn into primary oocytes, and remember they're arrested in prophase 1. So these were those primordial follicles that we were talking about. So the follicular cells with the oocyte in the middle. And then we're going to see that primary oocyte stays arrested during childhood because the ovary is inactive. Now we're going to see here in yellow, puberty. When puberty happens, this primary follicle is going to get triggered to become a secondary follicle. So now we're talking monthly. We're going to see this primary follicle triggered to become a secondary follicle, an antral, and a mature. So talking about what's happening inside the follicle, right? The oocyte is inside the follicle. Inside the oocyte, it's going to complete meiosis 1. So now we have 2 cells. This cell would be called the secondary oocyte. Now remember, the secondary oocyte is inside this growing follicle, right? So we talked about polar bodies a little bit. We said here's this initial primary oocyte. It's going to complete meiosis 1, and this polar body is going to donate the cytoplasm. See the size difference? They're not equal, right? When we looked at sperm, they were all equal. So this polar body, what does it do? It donates all of its cytoplasm, but it helps keep those extra chromosomes away from what's going to potentially be the egg. So the secondary oocyte finishes or has already finished meiosis 1. It starts meiosis 2, but then it stops and arrests in metaphase 2. So remember, metaphase is when all the chromosomes are lined up in the middle, right? And they're going to get pulled apart. So this secondary oocyte that's inside the mature follicle is what actually gets ovulated. So they're saying ovulation of the secondary oocyte. So hopefully you see, if I say primary oocyte, I'm talking about the cell, right? The oogonia, the cell that has the DNA. And if I say a follicle, I'm talking about the oocyte that's surrounded by those granulosal cells. All right, so we finished meiosis 1 as we move from primary oocyte to secondary oocyte. Secondary oocyte starts meiosis 2 but gets arrested in metaphase 2. Then we're going to see the trigger of ovulation where the secondary oocyte is ovulated, ejected from the follicle, from the ovary, and is now in the uterine tube. When sperm actually make it through the zona pellucida, when the sperm enters, we're going to talk about a series of events that occur, and then we have the completion of meiosis 2. So again, you can have a second polar body, and then you'll have your ovum. So one of the things that people usually ask is, why do we have all of these starts and stops? Why does the egg start meiosis 1 and stop in prophase 1? Why does it continue meiosis 2 but then stop in metaphase 2? And then why does it not do meiosis 2 completion until after the sperm? And I think a lot of it has to do with conserving energy, right? So what are the chances that this primary oocyte is actually going to get fertilized and actually become the zygote, the fertilized egg, right? And chances are not super high. So why waste the energy to do the cell division, to do meiosis 1 and meiosis 2, if I'm not going to be the one that's selected to grow up into the secondary follicle? So there's some things we still don't really understand, like what's the selection process? How does this primordial follicle get triggered to become a secondary follicle? So when we're talking about these primary oocytes in a primary follicle, we have no idea the likelihood that that's going to get fertilized. So then now we're here at our secondary oocyte. What's the likelihood that this secondary oocyte is going to be fertilized by sperm? This secondary oocyte has been chosen. It is going to grow up. We are going to see this secondary oocyte ejected from the mature follicle. But what's the chance that that secondary oocyte is going to meet sperm? So lots of times, if there's no sperm present or the sperm doesn't penetrate the egg is just going to go through the uterine tube and through the uterus and come out, and you wouldn't even know it, right? So the chances that the sperm is actually going to make it to fertilize the egg is pretty low. So why waste the energy of finishing meiosis 2 beforehand? Why don't you wait until the sperm are actually there, and then we can finish meiosis 2? So we'll talk a little bit more about this in development. Here we have a nice figure that's showing you how the hormones correspond to ovary cycle or ovarian cycle and the uterine cycle. So we just looked at follicular phase, where the antral follicle's turning into a mature follicle. We looked at ovulation, where the oocyte is being ejected, and then the luteal phase, where the corpus luteum is secreting estrogen and progesterone. They're just correlating that to the ebb and flow of estrogen and progesterone. So you can see estrogen is increasing here as those granulosal cells are increasing. Remember, the granulosal cells are secreting estrogen. And then remember, the corpus luteum is high in progesterone. So we can see here that the progesterone level is really high in the luteal phase. They're showing you how do those hormones correspond with what's happening in the uterus and the uterine lining. So we can see as estrogen is increasing, so is the lining of the uterus, the endometrial lining. And then at the end, here in the luteal phase, we have high progesterone, and that directly correlates to the highest, thickest level of the endometrial lining. For the FSH and LH, we're going to talk about how these are actually triggering the development from that antral follicle to the mature follicle, and that we have this peak of LH right at ovulation. So perimenopause, time near menopause, this is when periods start being skipped or they're irregular. Menopause, 45 to 55, this is where there's no uterine lining, no sloughing off, no growth, no menstrual period for a year. Here we have in words what we're going to look at in an image in just a second, but hopefully we can follow that the hypothalamus is going to secrete GnRH. That's going to stimulate the anterior pituitary to release FSH and LH, and these are going to target the ovaries, particularly follicle growth, right? So we're going to see estrogen is going to assist in the development of the ovarian follicle, and we're going to see that antral follicle is now dependent on FSH and LH to mature into that mature follicle. So here we see GnRH released from the hypothalamus, telling the anterior pituitary to release FSH and LH. That's going to trigger the follicle development, right? So we're going to see low levels of estrogen to assist with the follicle development. Remember that LH is talking to the thecal cells, having them secrete androgen, and then that causes the granulosal cells to secrete estrogen. So we're going to see this antral follicle develop and grow into this mature follicle. You can also see that there is a feedback, right? So once we turn on FSH and LH and this follicle starts growing, we're going to go back, release inhibin, turn off FSH and LH and GnRH, right? You've told us to grow, we're growing. And then once we have this mature follicle, estrogen levels are really high. So we had only so many granulosal cells here, and now we can see we have tons of granulosal cells. So they're spitting out tons and tons of estrogen. So this high level of estrogen goes to the anterior pituitary, hypothalamus, and triggers the release of that LH, which is what causes the secondary oocyte to be ejected from the ovary. And then we're going to see that the corpus luteum, which secretes large amounts of progesterone and some estrogen, can also go back and inhibit anterior pituitary and hypothalamus. So basically, we're turning FSH and LH off again. So it was on, then it was off, then we turned it back on again, and then we turned it off. So a little bit more confusing than the male, where we just turned it on and we turned it off. Here in words, we have just kind of the second half of the slide that we just went over. We know that the mature follicle, when fully developed, is producing tons and tons of estrogen, right? That's where we saw that term high estrogen. That is what stimulates the hypothalamus and the pituitary to release that surge of LH so that we can have ovulation. So that LH surge causes the secondary oocyte to be ejected from the mature follicle. The remaining granulosal cells become the corpus luteum. They're going to secrete progesterone and estrogen and inhibin goes back and turns off GnRH, FSH, and LH. The cycle is going to repeat. We're going to see LH levels reduced. We're going to see levels of estrogen, progesterone, and inhibin drop. So we're going to see a drop in all of these. And then we're going to see GnRH starting the cycle all over again. So here again, we have GnRH signals the anterior pituitary to release FSH and LH. That causes development of the follicle. We're going to see the LH talk to the thecal cells. We're going to see estrogen being secreted. But when this follicle is triggered to start growing, it is also going to release inhibin. And the low level of estrogen in combination with the inhibin tells GnRH and LH, FSH to shut off. So we're on, you told us what to do. Now I'm going to turn them off while I grow. So we go from primary, or this antral, to a mature follicle. Once the follicle is fully mature, the estrogen levels are really high right now, right? We have tons of granulosal cells. They're kicking out tons of estrogen. That high level of estrogen is going to tell the anterior pituitary to release LH, and there's also some FSH released here. And it's going to tell the hypothalamus first to release GnRH, which then tell the anterior pituitary to release LH and FSH. So the remaining granulosal cells will become the corpus luteum, and the secondary oocyte is ejected from the ovary. Corpus luteum is going to continue to secrete progesterone and estrogen. It's also going to secrete inhibin. And inhibin is going to go back and turn off GnRH, LH, and FSH. So a little bit more confusing. First we're on. Then we go back and tell them to turn off while we grow. And then once we get large enough, we're going to have that high estrogen trigger LH and FSH to be back on again. And then once the corpus luteum is formed, creates inhibin, and we turn off FSH and LH. So there's no reason to leave the hormones on all the time, right? It's a lot of wasted energy if we just left the FSH and LH on all the time. We're waiting for the follicle to grow before we turn back on the FSH or LH for ovulation. If the secondary oocyte is fertilized by the sperm, and if it implants in the uterus, this embryo, it says they call it a preembryo, most people would call it an embryo, it'll start secreting HCG. This is human chorionic gonadotropin. So this will be secreted, and it will mimic the effects of LH and continue the corpus luteum production of estrogen and progesterone. So corpus luteum is the first, right, hormone that's going to help produce estrogen and progesterone and maintain the uterine lining where the embryo is implanting, right? Then the embryo starts making HCG, which then helps continue the corpus luteum from keep doing your job, produce estrogen and progesterone. And then eventually, after about 3 months, the placenta is fully formed. And now this can produce the estrogen and progesterone enough to maintain pregnancy. And then the corpus luteum will degrade into the corpus albicans. So this hormone, this HCG, is the hormone that we measure in pregnancy tests. I put this slide in here about ovarian cancer because it is the 5th most common cancer in women, and you can look through these symptoms and see why it wouldn't be diagnosed very early. It's often detected late. A lot of these symptoms are nonspecific: constipation, nausea, back pain, weight gain, abdominal swelling, pelvic pain, right? Some of these could just be normal symptoms from a monthly cycle, painful periods, right? So there's no test really for this disease. And usually don't find it until it's almost too late, right? So that concludes this first part. And the next part, we will get into the uterine cycle, and we'll talk about the endometrial lining. And we'll come back and visit some of the ovarian cycle again. We'll look at that chart again that kind of talks about the FSH, the LH, what's happening in the ovary, correlate it to estrogen and progesterone, and then correlate that estrogen and progesterone release to what's happening in the uterus. All right, I'll talk to you guys soon. Bye.